Clitoral hood reduction is a surgical procedure which is generally part of labiaplasty procedure or reduction of labia minora lips. When we perform labiaplasty or actually any cosmetic surgery, what happens is that anatomy gets altered. So the full appearance of a particular area changes, and it's easier explained with the face, for example. If we make the nose smaller, the eyes look bigger. However, we did not do anything to the eyes. And the same applies to the genital area. If labia minora are decreased in size, then other areas such as clitoral hood will look more prominent, or if there is any skin tags or anal tags, they will also look prominent. At times vaginal gaping appears when the labiaplasty is performed. So thinking of the cosmetic alteration should include understanding of what would happen with this one area change to the other areas in terms of general look. Clitoral hood reduction is generally a part of labiaplasty surgery. It's performed under local anesthetic in the office, and a detailed discussion happens before the operation to discuss the anatomy, to address patients' expectations, to explain what is and is not possible, and go through the risks of the procedure. Operating in the clitoral area would be associated with a risk of nerve injury, hence knowing anatomy and understanding functionality of the area is very important, as we try to avoid any kind of long-term negative effects with change in sensation of the area. There are different types of clitoral hood reductions, and the type would depend on the anatomy of the woman. The possible complication and post-procedure care is the same as for labiaplasty procedures, or painkillers, lots of icing the area in the first 24 to 48 hours post-surgery, and wound care that would decrease development of infection. We know that following labiaplasty, 95% of women are more satisfied with sexual activity, and that generally depends or is explained by their self-confidence greatly improved after labiaplasty, and the same applies to clitoral hood reduction. So in terms of sexual pleasure, lots of women find it they're happier afterwards. Also, as we decrease amount of skin covering the clitoris, the sensation in the clitoris itself is easier felt. Should you have a clitoral hood reduction or not is very individual and should be discussed with your doctor.